Good afternoon, ladies and gentlemen. Welcome to this new webinar from the European Menopause and Andropause Society. Today, our speaker, and as you can see on your screens, is Dr. Peter Chedraui from Ecuador with the topic Menopause and the Metabolic Syndrome. And before to start with his presentation, I would like to remind all of our attendees that in the case that you have some question to our presenter, you can use the questions function that you will find in your control panel, and at the end of this webinar, Dr. Chedraui will answer kindly. So now, please, Dr. Chedraui, when you want, you can start with your presentation.
Good morning, everybody. Well, it's morning here. I'd like to thank the European Menopause and Andropause Society for the opportunity to have this chance to transfer knowledge, and which is a very important issue for an issue and mission of our society. As a member of the board of the EMAS, it's an honor for me to participate and collaborate with these kind of initiatives. Today we're going to talk about the menopause and the metabolic. As we all know, as we can see in this slide, as women age, they increase in their weight. Here we have a sample of patients or women from Dr. Blumen's study of 2001. As you can see, as ages passes, women increase weight. This is very important because it is not known if it's directly the aging process per se, or it is the lack or the decrease of estrogenic secretion that it makes women increase their weight. But as women age, in fact, they increase weight. This is important because as women age, there comes a series of problems that women have during this transitional phase during the menopause. As we can see here, as we have extensively analyzed using diverse types of tools, that women present a high degree of vasomotor depressive symptoms, muscle and joint problems, more than 70% determined with different screening tools, and postmenopausal women have impaired quality of life and increased vasomotor symptoms that have been related to chronic conditions such as the metabolic syndrome. The third adult treatment panel, as we can see, of the U.S. National Cholesterol Education Program has established criteria for the identification of the metabolic syndrome in men and in women. These metabolic syndrome is diagnosed when 3 or more of the following risk factors are present. These risk factors, according to ATP3 criteria, are abdominal obesity in women, more than 88 centimeters waist, high triglyceride levels, low HDL-C cholesterol levels, their blood pressure equal or more than 130 over 85 millimeters mercury, and fasting glucose equal or more than 110, and according to the modified ATP3 criteria, it is 100 milligrams DL or more than. The key defect in people who have the metabolic syndrome, disregarding if it's only menopausal women, it is the insulin resistance. Insulin resistance is the key promoter for various of the derangement that we can find in the metabolic syndrome. Hyperglycemia, hypertension, intolerance to glucose, metabolism, obesity, endothelial dysfunction, dyslipidemia, and macrovascular disease. Insulin resistance per se is a high predictor of cardiovascular risk, such as strong as smoking, as we can see in this slide, more than age and more than total cholesterol or HDL-C. The prevalence of the metabolic syndrome may vary and depend on various factors. Basically, geographical zone of the studies or population study, ethnics, age, sex, the gender, and the menopause. More or less 30% of women after the menopause have the metabolic syndrome. The prevalence of this syndrome in adults, as you can see in this classic study, in adults in the United States, as you can see in men and women, the prevalence increases as individuals age. As you can see, after more than 70 years, women have the prevalence is higher in women than in men. It is also related to sex and race. As we can see, women from Hispanic origin, Mexican Americans, and in women and in men have a higher prevalence of the metabolic syndrome as compared to Caucasian and Afro-American and other ethnics. This is one of our first studies. We performed a lot of studies regarding the metabolic syndrome, and this is one of our first studies performed 11 years back when we determined in our Ecuadorian or from Guayaquil population that the metabolic syndrome according to ATP3 criteria. We found that 41.5% of postmenopausal, natural postmenopausal women who were not using HRT have the metabolic syndrome. As you can see, a high degree of women have abdominal obesity, determined even more higher than central obesity using body mass weight index. And the most important thing in this study is that we screened and we tried to find out and what is their knowledge about what they have. And it was very surprising to see that more than 40% of women who were screened for the metabolic syndrome did not know that they had blood pressure or that they had hyperglycemia, which this was determined per se during the study. This is important, as we will see later. This has a very important social component that has to be enhanced through programs that we will explain here. High triglyceride levels in this study. As you can see, 56.9% had high triglyceride levels. In a second study we performed in postmenopausal women, we determined a 52.9% of women who had the menopause, the metabolic syndrome, using ATP modified criteria. Equally, we can see that a high degree of women had abdominal obesity, 58.3% of them. We performed many years back, 10 years back, we did a large cohort series, a cross-sectional study in 3,965 Latin American postmenopausal natural women to determine the prevalence of the metabolic syndrome. As you can see in this slide, the prevalence varied from 19.7% in Cusco, Peru at high altitude to 65.6% in Santiago de los Caballeros, which is from the Dominican Republic. An average rate was 35% of the metabolic syndrome, and a high percentage of women had abdominal obesity, as we can see, 49.3%. The study determined that as women age, you can see as years or the quintiles increase, the rate of metabolic syndrome also increases. And we determined through logistic regression analysis that the factors related to, perhaps we cannot say risk factors per se, but the factors that were related or associated to a higher degree of metabolic syndrome were age, years since the women have their menopause, and the use of women who were using at that time HRT had a decreased prevalence of the metabolic syndrome. We'll speak about this later on in other slides, the importance of our study, what we did at that time, coming now to the current time, which is very important to establish this connection with HRT. When we analyzed our data, we found that individually, looking at each of the features of the metabolic syndrome, we see, as you can see in the slide, diabetes, hypertension, and each one of the components of the metabolic syndrome are related or correlated to each other. But as you can see, a main feature or dominant feature is abdominal obesity. As we said at the beginning, abdominal obesity is a very important component and probably linked to insulin resistance, which is the key factor, the key issue that goes around the definition of metabolic syndrome and is the factor that increases cardiovascular risk, as we will see. Here we can see the prevalence of the derangements of each of the lipid profile. As you can see, abdominal obesity is high prevalent in women who have is the most important feature, and you can see in this slide, which is in correlation with this classic study of Ford, as the dominant feature of the metabolic syndrome is abdominal obesity, even higher in women than in men. We took our cohort a little bit further, and also we screened other issues very important to correlate with the metabolic syndrome. And the other day I was reviewing a bit of the literature and saw that there are a lot of studies now that correlate obesity and correlate the metabolic syndrome with increased symptomatology of the menopause. This is now, but as you can see, our slide is 2006, which is like 11 years back, when we started trying to establish this connection. At that time, there were some studies, the SWAN study, that correlated the differences in women who were of Afro-American and who were obese, who had more symptoms of the menopause. So in these two papers, that we see that women who had the metabolic syndrome had higher increased menopausal symptoms, and this was correlated basically to obesity. And also, using the same Menopause instrument, we determined that quality of life in these women was impaired. So the association between vasomotor symptoms and metabolic health in peri and postmenopausal is a fact now that we saw 11 years back. Now it is subject to systematic reviews, as you can see here. And when you see where it's in red, it says that the positive association between vasomotor symptoms and insulin resistance and type 2 diabetes is very important. And this is what possibly increases their risk, their cardiovascular risk. And as we will see in some other slides, why is this cardiovascular risk increased? Changing subjects, that we also determined years back that there is some kind of correlation possibly to this endothelial dysfunction. We saw that women who have hyperglycemia have the component of the metabolic syndrome have higher or decreased libido and higher scores for dysfunction, sexual dysfunction, using the sexual domain of the MinQOL, which is an instrument composed of various domains. In our second cohort of 204 women screened for the metabolic syndrome, we tried to link or find an association between insomnia and the metabolic syndrome, and we did not find any correlation, but we found that, again, hot flushes and in their intensity and depressive scores and parity were correlated to insomnia. Here, as we see, metabolic syndrome increases cardiovascular risk. Not only coronary heart disease mortality increased, also disease mortality related to coronary cardiovascular disease and all-cause mortality. 2 times the higher risk as compared to people who do not have metabolic syndrome is increased in women and in men who have the metabolic syndrome, and also when compared Hispanic to Afro and Caucasian women. We presented a poster years back related to our cohort, and we found that among those who had the metabolic syndrome, their cardiovascular risk at 10 years, using this risk assessment tool, which is very easy to use. One can use this in the routine clinical practice. We determined that women had a 4% or 2 times more percent higher among those who have the metabolic syndrome to have a cardiovascular risk at 10 years. But why is this cardiovascular risk increased? As you can see here, we have an adipocyte secretes several types of pro-inflammatory, inflammatory and pro-inflammatory and anti-inflammatory cytokines. But when the adipocyte, possibly deranged due to the lower secretion of estrogen, which is very important for the adipocyte, as women increase their weight, they have an ill adipocyte. And this ill adipocyte secretes several pro-inflammatory adipocytokines. As you can see, the most important, here we have a panel, which we think the most important are leptin, interleukin-6, tumor necrosis factor alpha, among others, as you can see in the slide. And this is the pathway between the obesity, abdominal obesity, and cardiovascular disease. We have women who become sedentary at midlife. They increase their caloric intake. There has to be a genetic factor background which increases their abdominal fat. This abdominal fat, as I said in the first slide, can depend maybe on aging per se, metabolism decreases, and also related to the decrease in estrogenic secretion. Well, if this abdominal fat increases, we increase free fatty acids, we increase the secretion of adipocytokines, as I already said, interleukin-6, tumor necrosis factor alpha resistance, which leads us to insulin resistance, an increase in triglycerides, low HDL-C levels, LDA high levels, which takes us forward to diabetes, cardiovascular risk, and of course, with increased insulin resistance, we have obesity, derangements of glucose metabolism, and we have the metabolic syndrome. So this is the pathway through where we go to the cardiovascular. Let's see, we did this cohort, but we also analyzed biochemical factors, and we see that in our cohort that as years pass and as we have more increased waist circumference, we have higher levels, a direct correlation with interleukin-6 levels. As years pass and time since menopause passed, we have also higher levels of tumor necrosis factor alpha. The number of criteria met for the METs using ATP criteria are in direct correlation with interleukin levels, and the tumor necrosis alpha also correlates directly with blood pressure, systolic blood pressure, and number of metabolic syndrome criteria, direct proportionally. We analyzed with Professor Simoncini and our team from Guayaquil, and we analyzed what the levels of pro-inflammatory cytokines in correlation also to nitric oxide levels in postmenopausal women with metabolic syndrome. This is our same cohort that we've been analyzing biochemically and clinically and biochemically. We see that the levels of nitric oxide, according to each of the components, we saw a correlation, a higher levels of nitric oxide levels in women who have higher glycemia levels, triglycerides, lower HDL-C levels, and a correlation directly with the number of the metabolic syndrome criteria. These postmenopausal women with the MET displayed higher nitric oxide levels in relation to several of the syndrome features: hyperglycemia, high triglyceride levels, and low HDL-Cs, and the number of components. The important issue in this research is that our metabolic syndrome postmenopausal women were not so old, and this indicates that these higher levels indicate reactive or the initial phase of higher levels of nitric oxide, which are compensatory to the inflammatory status that these women have, indicating, and this research, basically the main line is that it corroborates the timing or the window of opportunity, which is the time where women can receive HRT, when we still have a healthy endothelium, which secretes high levels of nitric oxide, which would be favorable for cardiovascular risk. Whereas women who are older would have a dysfunctional cardiovascular or system or endothelia and would not secrete and would find lower levels of nitric oxide. This is what we're trying to study now, analyze women who are in the early phase of the postmenopause and compared to those who are premenopausal and compared to those who are late after 5 years to determine if there are differences in nitric oxide secretion and other biochemical markers of inflammation, which is subject to research we're performing now, and we will have soon data and publications in this regard. We also analyzed, as you can see, angiogenesis factors, inflammation, endothelial function, and we found basically, due to the small sample size, we found a correlation and confirming that interleukin-6 among women who have the metabolic syndrome criteria modified by ATP3, higher levels as compared to those controls who did not have the metabolic syndrome. But as you can see, there is a trend for higher levels of all the other features and lower levels of eukinase PA, which is a marker of endothelial function. The same paper, just showing some graphics. We also determined adipokines. Basically, we found higher levels of leptin, resistin, adipsin, and lower levels of adiponectin, and analyzing insulin and HOMA-IR indexes. we found higher levels of insulin among those who had the metabolic syndrome as compared to those who did not have the metabolic syndrome. We tried to analyze some of the genetics involved in this, and we found comparing polymorphisms of the FTO, the fat mass gene, and MTHFR, which is the methyltetrafolate reductase gene, and vascular, inflammatory, and metabolic markers. We tried to correlate some of these markers, and we found higher levels of SCD4L, a marker of endothelial function, and bisphatin, adipocytokine, higher levels among those who had the profile, genetic profile, AT plus AT of the FTO gene. So, taking all this together, clinical symptoms and biochemical markers, cardiovascular risk. So, does it make a difference to treat or not treat the metabolic syndrome? In this diabetes prevention study of Finland, 520 mid-aged participants who were overweight or obese with a mean body mass index of 31 kilogram squared meter, 170 men and 350 women, during 3.2 years were subject to intervention, individual counseling, weight reduction, intake of total saturated fat, which was decreased, increased intake of fiber, physical activity. What happened after 3.2 years? After 4 years, there was a 58.6 reduction in the prevalence of diabetes in the intervention as compared to the control group. So this means that these lifestyle interventions make a difference in preventing derangements found in the metabolic syndrome, and therefore this decreases their cardiovascular risk substantially. Not only it is important to promote a correction of hypertension and dyslipidemia, also promote the decrease of the prothrombotic and the inflammatory state that is found in people subjects who have the metabolic syndrome. So social aspects of the metabolic syndrome. This is important because this study from Portugal, Brazil, has found that people who are of lower social classes or less educated and have are less professionals or less educated are more frequently presenting the metabolic syndrome. And this is an important issue because in Latin America, and where poverty is very important, not only from perinatal point of view, it is also important for midlife health. The reduction or education of women towards an improvement in their lifestyle would be have a very positive impact, and not even using treatment, just using a program that enhances lifestyle changes. So the treatment of, for example, here in this slide, the reduction of LDL-C, with a background of low income associated to the metabolic syndrome, we should change the lifestyles as a primary measure to promote measures not only in the postmenopausal phase, but also in premenopausal and perimenopausal phase, where the problem is still not very evident. So we organized a small research with one of our postgraduate students. We took 105 postmenopausal women who already had the metabolic syndrome to take part of an educational program. We surveyed them to explore their knowledge regarding the menopause and related issues and the metabolic syndrome. And then we gave them some knowledge intervention, educational chats and sessions and educational sessions. So this is what we found. As you can see, compared to before and after, we made a questionnaire of 10 questions or 20 questions, don't recall exactly. But as you can see, the mean score before the education program was 6.1, and after it was 8.8. So we increased their knowledge. And as you can see, a lower percentage of women knew what in fact was the menopause, what is diabetes, what is osteoporosis, what are normal levels of glucose, and other, how can reduce your cardiovascular risk. Only 42.9% knew, and then we increased their knowledge after we gave them education. So this is very important because as a cost-effective measure, if we teach women, especially in countries where poverty is shadowed by poverty, we can educate them to enhance or improve their lifestyle aspects or their lifestyle, and we can therefore have a better outcome and reduce their cardiovascular risk. So in conclusion, after the menopause, women present important endocrine and metabolic changes that increase the prevalence of the metabolic syndrome, which in turn may impair their quality of life and also increase cardiovascular risks through pro-inflammation. The prevalence of the metabolic syndrome in postmenopausal women worldwide, also in Ecuador and in Latin America, is high. As obesity and low knowledge of the disease is the main problem, programs should be directed towards spreading knowledge in high-risk populations and promoting changes in lifestyles. I would like to take the opportunity to invite, as a board member of EMAS, to invite to the 12th European Congress Menopause and Andropause to be taken out 15th to the 7th of May 2019 in Berlin, Germany. Thank you very much for your assistance to this webinar, which is a very important goal, important tool for EMAS to spread knowledge, which is one of our objectives. And I think that this is very important. I thank Tommaso Simoncini as the president for giving me the opportunity of being part of this project. Thank you very much.
Thank you very much, Dr. Chedraui, for your presentation. It was really a pleasure to hear you. And now we continue with the next activity in this webinar. That will be our polls. And the method to participate, it will appear a question as a pop-up on your screen, and you have a few seconds to select the correct answer. So here we have the first one, but before you to vote, I would like to read completely the answers and the question, because there are some characters that are limited due to the software. So I will proceed to read. Which of the following meet the diagnostic criteria from the metabolic syndrome in women? And the option A, it's abdominal obesity, abdominal circumference higher than 88 centimeters. The option B, it's serum triglyceride levels higher than 150 milligrams per deciliter. The option C, HDL-C levels lower than 50 milligrams per deciliter, or all above are correct. Here we have the results from our attendees. Which of the following meet diagnostic criteria for the metabolic syndrome in women? And 50% of our attendees answered the option A, abdominal obesity, abdominal circumference higher than 88 centimeters. There were no answers for the option B and C, and 50% of our attendees answered the option D, all above are correct. That in this case is the correct one. So we continue with our next poll. Here we have the results from our second poll today. After the menopause, the prevalence of the metabolic syndrome increased due to following reasons. There were no options for the option A and B: increase in body weight and increase in insulin resistance than enhance diabetes risk. And 100% of our attendees answered the option C, both A and B are correct, that in this case, all of our attendees were right with the answer. It was the option C. And we continue with our last poll today. Here are the results from our last poll today. Increased cardiovascular risks observed among women with the metabolic syndrome after the menopause are aligned to. There were no answers for the option A, higher circulating pro-inflammatory adipositokin levels. There were no answers also for the option B, increased insulin resistance. And 100% of our attendees selected the option C. Both A and B are correct. That in this case is the correct answer, the option C. And before to finish this webinar, I will want to give 1 more minute to our attendees. So if you have some extra questions for Dr. Chedraui, for our presenter today, you can write using the questions function that you can find in your control panel. But in the meantime, I would like to ask Dr. Chedraui if you want to add something to your presentation, or you have some comment.
Well, the only comment I have is that I like very much the second and third question, 100%, 100%, which means that my chat is not boring, definitely. The first one is very strange, and I don't understand why people only answer 50% and the other 50% add, the correct answer. But it's surprising. But I feel very how do you say? I feel very happy that people got the message, the inline message, which is very important for these webinars. So this is, I think that this is important.
Thank you very much for your comment. This is, you know, that this is one of the purpose of this webinar, to extend the educational program between all the professionals worldwide, and this is one of the missions from the EMAS Society. And it looks like that we don't have more questions, so I would like to thank you, Dr. Chedraui, for the presentation today. It was really a pleasure to have you with us in this webinar series from EMAS.
Thank you. I would thank you very much. Thank you very much.
And I would like to remind our attendees next month we will not have a webinar. We will have in the next month of September. So we will be very happy to have you again here, and wishing you a fantastic holidays if you have, and if not, a fantastic summer and day. Thank you very much.